Now we are seeing the transverse section of the uterus of a patient, a 30 years is Paris. Now she had in fact cesarean section 3 years back, and since then she is complaining of menorrhagia, history of menorrhagia and constant pelvic pain. She has gone through many ultrasound, but here what we see is that the uterus in transverse section is normal. There is a dense echogenic area seen in the endometrial canal, and in this view you can see only this much, and these are the iliac vessels. So this is the transverse section, and these are the vessels. Now when I move the probe longitudinally, I see that first just concentrate on the uterus, and you will see that here is the uterus. I am trying to align the uterus with vagina, and the uterus is being seen at this umbilical region. Now this is the umbilical region where I am seeing the uterus in longitudinal section incomplete. This is the uterus measuring 6.89 centimeter by 4.1 centimeter, and at the frontal region you see echogenic area of approximately 5.8 millimeter, which is within the endometrial canal, which is a bit displaced here. Now it gives a shadow, sharp shadow, posterior shadow, and let me show you another. Now the cervix is clear, and the vagina is also being lifted upwards. These are the vagina. This is the vagina, and here comes here comes the cervix, then the anterior myometrium, posterior myometrium, the endometrial canal, and you see it's almost seen fixed with the anterior subcutaneous tissue, and is only 2.9 mm deep to the subcutaneous tissue. This is the subcutaneous tissue, and the peritoneum you are seeing. This is the peritoneal line, and this. Now what's elevating it is an echogenic area measuring approximately 6.1 centimeter in length and 8.6 millimeter in anterior-posterior diameter. Now this is a foreign body which gives a sharp posterior shadow, and because of this foreign body, we see that the vagina is elevated, the cervix is elevated, and the whole uterus is elevated by this echogenic band. This is not the urinary bladder. You see, I am going to move the probe posteriorly downwards now, and you will see that this is the urinary bladder. Just wait, I will repeat it as I am short of gel. This is the urinary bladder, this area. You see, and from the urinary bladder, you see that there is a linear echogenic area seen. Now this is the urinary bladder indeed, this one. This is the urinary bladder, and from here, when I move the probe upwards towards the umbilical region, I see a longitudinal echogenic band of echogenic linear structure measuring here 5.6 by 6.5 millimeters, and C. And the important thing is the degree of posterior shadowing from it, that is suggestive, indeed suggestive of a foreign body. And here I am at the umbilical region and see the, now here you will be able to see the fundal region and the endometrial canal. The endometrial canal is fluid filled. This is the fluid in the endometrial canal. This is the endometrial canal at the tip of which we see an echogenic area. Here. Now this is the endometrial canal. This is the foreign body. And this foreign body can be traced downwards up to the urinary bladder. Here comes the urinary bladder. This is the urinary bladder. And from here we see a band of echogenic band lifting the uterus upwards. This is the transfer section of the uterus. There is no fluid around, and this is the urinary bladder. Again, to repeat it, the foreign body, the uterus, which is elevated by this band of. So this is our case of the day. Thank you very much.